Hi everyone, Dr. David Sayah, plastic and reconstructive surgeon. I am going back to my general surgery years. As you may know, I was a fully trained general surgeon before specializing in plastic and reconstructive surgery. We've already talked about breast cancer prevention and diagnosis. Now I want to talk to you all about breast cancer treatment. As you can imagine, breast cancer treatment is an extremely wide field, but I just want to categorize it as three different treatments. One is medical, and the second category is surgical. Within the second category, we can talk about lumpectomy or mastectomy. Um, as time goes on, surgeons are more and more emphasizing conservative treatment for breast cancer, which means more and more lumpectomies. It's important for me to highlight to you that as someone who's reconstructed breasts who were treated conservatively with a lumpectomy, if you have a lumpectomy, usually they'll recommend radiation, and it's much harder to reconstruct a small breast with radiation than one that has had a skin-sparing mastectomy or the breast totally removed, preserving the skin that's on the outside. So please talk to your breast surgeons if you have relatively small breasts, and if the lumpectomy is going to deform your breast quite significantly with or without radiation, in which case you may consider just a mastectomy. And in addition to the surgical treatments of lumpectomy or mastectomy, you also have medical treatments, which would include all sorts of immunotherapy, chemotherapy, and radiation therapy. It's important for you to consult with an oncologist in regards to which combination of treatments are best for you. And at the same time, please consult with a plastic and reconstructive surgeon such as myself. There is an evolving field within medicine and breast surgery called oncoplastic surgery, whereby the plastic surgeons help the breast surgeons determine what's the best approach for your surgery to have the best aesthetic outcome once everything is done. And that might mean approach in terms of the incision underneath the breast, preserving your nipple and areolar complex if possible. So again, please feel free to come to my office. We'll talk about your surgical options, both in terms of treating your cancer and reconstructive options thereafter. And please stay tuned for our next clip on breast cancer reconstruction. Thank you.